Good evening, everyone. So, after a long period of time, I'm again putting my video with you. I'm sharing my video with you. And before I start my video, I want to request you if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. And now I'm going to start on the topic therapeutic drug monitoring. I'm going to start with you on the topic therapeutic drug monitoring. Now, why therapeutic drug monitoring is required? It is because to know the levels drug concentration inside our body, which produces the desired response. And when the response is more, sometimes it can lead to side effects also. Like I stopped taking the medicine before because I prefer the original disease to the side effects. So the patient stops taking the medicine because of the overdose, because of the toxicity. So for that, we need to do the therapeutic drug monitoring. Introduction. Therapeutic drug monitoring is defined as the use of drug concentrations in body fluids as an aid to the management of patients receiving drug therapy. We know the drug concentrations in the body fluids. Why? For the cure, alleviation, or prevention of disease. Is it is as used as the aid to management of the patients receiving drug therapy for the cure of the disease, for the alleviation means for the elimination of the disease, and for the prevention of the disease. It is a tool that guides clinicians to provide effective and safe drug therapy in an individual patient. Means we have to produce the most efficacious and the safer drug therapy in the individual patient. So that's why we do the therapeutic drug monitoring. Now, why we require therapeutic drug monitoring? Now, there is a prescribed dosing regimen. There's a dosing regimen which is given, and there is a pharmacokinetic variability. Which there can be decrease in compliance. If there is decrease in compliance, the drug levels will be less in our bodies. So to check the compliance, we can do the therapeutic drug monitoring in medication errors, like there is underdosage or overdosage. To know that underdosage and overdosage, we do the therapeutic drug monitoring. To know the tissue and body fluid mass and volume, we do the therapeutic drug monitoring. And there are various pharmacokinetic drug interactions related to absorption, distribution, metabolism, and excretion. The drug interactions can occur. To know those drug interactions that is desirable and undesirable, we need to do the therapeutic drug monitoring. This is the pharmacokinetic variability. And this drug at site of action or blood concentration, it will produce a clinical effect. When it is producing the clinical effect or drug effect, there can be pharmacodynamic variability, like drug receptor status can be varied with the status of the drug, and the receptor can be varied. The genetic factors, like the different individuals, they have different genetic factors, different genetic body makeup in their body. So those genetic factors can affect the therapeutic drug monitoring of the patient. The therapeutic drug levels, drug interactions can affect, and tolerance. When there is repeated dosage of the drug is there, the patient can develop tolerance to a particular drug. So that we can know by the therapeutic drug monitoring. Now it is concerned with pharmacokinetics, is concerned with absorption, distribution, metabolism, and excretion. It is what the body does to the drug. That is, dose is given, then the body is what is doing to the drug. These resources or variables are considered while monitoring with absorption, distribution, metabolism, and excretion. When it reaches the blood concentration, there is a receptor interaction, receptor response. There can be pharmacodynamic variability, and then the clinical effect can be varied. The use of pharmacokinetic studies. Pharmacokinetic studies performed to examine absorption, distribution, metabolism, and excretion of a drug. So, therapeutic drug monitoring and pharmacokinetic studies help the physician provide optimum care. Now, we do the therapeutic drug monitoring and we study the pharmacokinetic studies. So, this will help the physician to initiate the therapy to achieve the maximum therapeutic effect for the patient in the shortest amount of time. As we're producing the maximum therapeutic effect for the patient in the shortest amount of time. We are minimizing the risk of drug toxicity. We are minimizing the risk of drug toxicity and ensuring drug side effects are controlled and minimized. This is less, the most efficacious drug treatment is given in between the safer drug levels and toxicity is prevented, side effects are minimized. So that's why we do the therapeutic drug monitoring. Now, this is helps in determining the loading dose. The loading dose is a large amount of the drug which is administered over a period of time to quickly move the patient's serum concentration toward a level that will achieve desired patient response. Means we give the large amount of dose at the one time only. So it will produce the drug levels in the body that will produce the patient clinical response in the patient. And another dosing can be needed to maintain the patient's serum concentration. The maintenance dose is the amount of the drug and dose frequency needed to achieve a steady state at the desired therapeutic concentration. Means it is to produce the steady state, the amount of drug and dose frequency needed to achieve a steady state at a desired therapeutic concentration. Now, this is the therapy is achieved. The required concentration has been achieved. The concentration would limit the lower limit. This is This is the therapy is achieved when the desired effect is attained because the required concentration has been reached. When the desired effect has been attained, that concentration would set the limit of lower limit of utility for the drug, like minimum effective concentration will be studied. Higher its concentrations are when there is maximum therapeutic concentration or minimum toxic concentration. And the therapeutic range is between the minimum toxic concentration and the minimum effective concentration. The range between that concentration, which is safe and effective, that is the therapeutic range. Now, why we do the therapeutic drug monitoring? It can guide the clinician to provide effective and safe drug therapy in the individual patient using serum drug concentration. Why should drug level be monitored? Certain drugs, they have a therapeutic narrow therapeutic range. That therapeutic range means the minimum effective concentration and the minimum toxic concentration is very close. So narrow therapeutic range is there. So a bit of increasing the dose can lead to toxicity. The drug can be toxic. And in concentrations below the lower limit, if the we decrease a bit of the dose, that can lead to ineffectiveness. The submaximal response will be produced. Not all patients have the same response at similar doses. Now, therapeutic range is the concentration range of drug in plasma where the drug has been shown to be efficacious without causing toxic effects in most people. Means the effective range without producing the toxic effect or without having the subtherapeutic response. That is the therapeutic range. This is the lag period, time taken by the drug to act. This is the minimum effective concentration for the desired response. This is minimum effective concentration for the adverse response or the minimum toxic concentration. This is the peak effect and this is the therapeutic window. And this is the onset of effect. This is the duration of action. Now, do all drugs require therapeutic drug monitoring? The therapeutic drug monitoring, if is given if the drug has narrow therapeutic range, therapeutic effect can be easily assessed by the clinical observation. Large individual variability in plasma concentration is there. A drug direct relationship exists between the drug or drug metabolites levels in plasma and the pharmacological or toxic effects. Drug follow non-linear kinetics. Means a direct relationship that exists between the drug or the drug metabolite levels in plasma and the pharmacological effects or the toxic effects. And drug follow the non-linear with zero order kinetics. In those cases, we require the therapeutic drug monitoring. So these are not required in all drugs. It is unnecessary in wide therapeutic range when pharmacological effects can be clinically quantified. And the drugs which have the first order kinetics, such as linear kinetics, we do not require therapeutic drug monitoring. And when the clinical outcome is unrelated to dose or plasma concentration, in those cases also we do not require therapeutic drug monitoring. This is the therapeutic drug monitoring of certain drugs. The therapeutic range and half-life is given. Like gentamicin, therapeutic range is 6 to 8 microgram per milliliter. Carbamazepine is 4 to 12. Lithium is 0.8 to 1.2 milliequivalent per liter. So these are the drugs which require the therapeutic drug monitoring. These are cardiovascular drugs like amiodarone, digoxin, digitoxin, isopyramide, lignocaine, procainamide, propranolol, and quinidine. Antibiotics like gentamicin, amikacin, tobramycin. Antidepressants like tricyclic antidepressants. Mood stabilizers like lithium. Antiepileptic drugs like phenytoin, phenobarbital, benzodiazepines, carbamazepine, valproic acid, and ethosuximide can be the drugs which require the therapeutic drug monitoring. Bronchodilators, as theophylline has the narrow therapeutic range, so theophylline can require the therapeutic drug monitoring. Cancer chemotherapy like methotrexate, immunosuppressants like cyclosporin. Now, what are the indications of therapeutic drug monitoring? Drugs for which relationship between dose and plasma concentration is unpredictable. Means the relationship between dose and plasma concentration, it is the unpredictable. So that is phenytoin. In those cases, we got therapeutic drug monitoring in narrow therapeutic range. That is the therapeutic range is narrow. Means the difference between the minimum effective concentration and the minimum toxic concentration is very less. So, bit of increasing the dose can lead to toxic effects, and bit of decreasing the dose can lead to subtherapeutic response. Now, drugs with steep response curve, the steep dose response curve, like this. This is the drug with steep dose response curve. Sorry, this is a drug with a steep dose response curve. Bit of increasing the dose can lead to toxicity. Bit of decreasing the dose can lead to subtherapeutic failure. And this is the gradual dose response curve. Means drug 2 requires the therapeutic drug monitoring. Like theophylline is the drug. Or to evaluate the compliance of the patient, means whether the patient is taking the drug or not, the compliance can be seen. The dose levels, the plasma concentration levels can be seen. Drugs in which there is difficulty in measuring or interpreting the clinical evidence and therapeutic or toxic effects. Like whether the therapeutic response to the drug is there, or whether the disease condition is because of the disease condition, the response symptoms are coming. Like nausea and vomiting occur in both digitalis toxicity. Digitalis is given to treat the congestive heart failure, and the patient of congestive heart failure also is having the nausea and vomiting. So to assess the reason of the nausea and vomiting, we do the therapeutic drug monitoring. For diagnosis of suspected toxicity and determining drug abuse, like for the suspected toxicity, any toxicity like poisoning is there, so we can diagnose it, and also for determining the drug abuse. Renal disease alter the relationship between dose and the plasma concentration. Important in case of digoxin, lithium, and aminoglycoside antibiotics. Means renal diseases, we all there is it will alter the relationship between dose and plasma concentration, because in renal disease there will be reduced GF or reduced tubular secretion, so drug will be accumulated in the body. So we need to decrease the dose. So, like important in case of digoxin, lithium, aminoglycoside antibiotics. When another drug alter the relationship between dose and plasma concentration, means in drug interactions, like plasma concentration of lithium can be increased by the thiazide diuretics. Means any interaction is there between the two drugs that can lead to alteration of the dose and plasma concentration. And to compare the bioequivalence of two drugs, means both the two drugs which have a similar bioavailability, we can compare those bioequivalence of two drugs. And when drugs are used for prophylaxis like phenytoin, means for the prophylaxis also of the epilepsy prophylaxis, we can give the phenytoin. So for that case also we can do the therapeutic drug monitoring. And when there's inter-individual variations in metabolism, like tricyclic antidepressants, we can do therapeutic drug monitoring. How does therapeutic drug monitoring work? The drug dosage to reach the therapeutic level must be determined on absorption, distribution, metabolism, excretion of drug, age, weight, and gender. Means it can be determined by uh, these pharmacokinetic parameters of the drug. Age can be varied, and weight and gender of the patient can vary the absorption, distribution, and metabolism of the patient. The doctor adjusts the dose upwards and tests blood concentration frequently until the proper steady state level is achieved. And slowly, the doctor will increase the dose of the drug, and then will record the therapeutic response. And when the desired therapeutic response comes, the steady state is reached, that will be seen by the doctor. The dose is specified. If patient levels are too high, the doctor will adjust them lower, and vice versa. Means if the those levels in the patients are very high, the doctor will adjust it lower, and if the dose levels are low, the doctor will adjust it higher. Now, therapeutic drug monitoring process, what is it? It requires the collaboration of scientists, clinicians, nurses, and pharmacists, and excellent communication is necessary to ensure that the best practice is TDM is achieved. Means in the therapeutic drug monitoring, these clinicians, scientists, nurses, and pharmacists, and excellent communication. Pharmacists will do the therapeutic drug monitoring, and there is excellent communication is necessary, and multidisciplinary function. It is the multidisciplinary function. Now, what are all the samples taken to note the dose levels? These can be plasma, serum, or whole blood in case of digoxin and lithium, saliva in case of lithium and amitriptyline, CSF or tears in case of amikacin, sweat in case of cocaine and heroin, breath in case of alcohol. Now, timing of the sample. Selection of correct interval between the drug administration and drawing of the sample for therapeutic drug monitoring depends on the purpose for therapeutic drug monitoring and nature of drug. Means we have to note we have to give the drug, and then we have to know the drug levels. What is the time of drawing the sample for doing the therapeutic drug monitoring? It is for the longer acting drugs, that is continuously acting drugs, it is prior to next dose. That is trough or steady state plasma levels are reached, and prior to next dose, after 5 to 6 half-lives, we can take the sample. In the short acting, the sampling is done in the post-absorptive phase. Post-absorption, we can do the therapeutic drug monitoring like ampicillin and gentamicin. Now, this is the diagram showing peak concentration and trough concentration. This is peak concentration, this is trough concentration. When poisoning, sampling can be done as early as possible. For checking the compliance, we have to take the random samples. And concentration levels are consistent with dosage non-responder. Means if the dose levels, they remain same by increasing the dose, it means the metabolism of the person is slow or the person is non-responder. And if the concentrations they are low, that is either the person is non-compliant or they are fast metabolizers. The information required to interpret drug concentration, specific patient information. What is the age of the patient, what is the gender of the patient, what is the weight of the patient. So we can note the body weight of the patient. These will affect the drug concentration levels in the body. Patient characteristics, if any, the patient is suffering from any cardiovascular disease, any renal disease, any hepatic dysfunction, or any alcohol intake is there, or smoking is there, that can affect the drug concentration. Specimen information means which specimen it is taking, either plasma, either serum, either whole blood, or we take the saliva, or we take the tears, that is specified. And drug information, that is what is the dose of the drug, what is the duration of the drugs, what is the dosage schedule of the drug, that is specified by the patient, and of that thing is specified, and then that can interpret the drug concentration. Now, these are the analytical methods which are used to know the blood concentration in our body of the drug. That is calorimeter, spectrophotofluorimeter, gas liquid chromatography, high performance liquid chromatography, and flame photometry. These are chemical methods. Amino acid, which will detect the presence of the drug in the body, like radioamino acid, enzyme linked multiplied amino acid technique, ELISA, fluorescence polarization amino acid. Now, these analytical laboratories, they must ensure that the procedure can provide any information for proper interpretation of the result. Means whichever procedure they are following, it provides the proper information and proper interpretation of the result is there. It should be accurate, it should be precise, it should be sensitive, it should be specific. And it should be done on the basis of external quality assessment program. And each analytical run, it should be appropriate calibration and standards. It should have appropriate calibration and it should have appropriate standards. And the verification of the results should be done by the senior staff. And results should be available as soon as possible, even before the next dose is administered to the patient. Yes, as soon as possible, the results should be made available. So it should distinguish between drug and its metabolites, the analytical methodology. It should detect the small amounts also. It should be specific. It should be unaffected by other drugs administered. And it should be accurate, precise, and linear. And communication of the result is, it should be interpreted as quickly as possible. It should identify which technique we are taking, doing the this drug concentration, that is therapeutic drug monitoring, and it should be expressed in the drug's concentration should be expressed in mass or molar units. Therapeutic concentration range for drug monitor to be mentioned. Is what is the therapeutic concentration range for the drug monitored? It should be mentioned. This therapeutic window should be mentioned. Now, therapeutic drug monitoring is a class specified indication requiring therapeutic drug monitoring. We should know the indication, whether to check the overdosage, whether to check the compliance, whether to check poisoning, whether to check tolerance, sampling at appropriate time, estimation of the concentration using appropriate method, interpretation of result taking into account clinical response. Means how we will interpret? Means we will adjust the dose, we will see the clinical response, and we will, in this way, we will note the effective concentration and the toxic concentration. Now, what is clinical usefulness? It is maximizing efficacy. Means we know the therapeutic range, minimum effective and minimum toxic concentration. So, the dose levels which are most effective that can be seen. Avoiding toxicity means we avoid the overdoses. We differentiate adverse effect from the disease. Means if levels are more, so it shows that the adverse effect has come from the disease. We can differentiate. Altered pharmacokinetics like hepatic and renal failure, we can know the therapeutic drug monitoring. If there is therapeutic failure like non-compliance, subtherapeutic dose, drug interactions, decreased bioavailability or malabsorption can be there. So that is, there is therapeutic failure is there, so it can be seen or it can be identified. Short hospital stay will be there because we do the effective therapeutic range is specified and effective drug therapy is given. Better disease control, dose adjustments can be done. Those guidelines are made by doing the therapeutic drug monitoring. Individualized dose requirements, avoidance of unnecessary medication can be there. Now, pharmacokinetic impact is rising health costs, growing concern amongst the clinicians and public. There's a lot of health costs rising, the whole lot of this drugs costs are there. So that can lead to we have to apply the principle of pharmacoeconomics in therapeutic drug monitoring as an intervention. Therapeutic drug monitoring may improve patient response because we are doing therapeutic drug monitoring that will increase the patient response to a life-sustaining drugs and decrease the adverse effects. Thus, the positive outcome can be measured by reduced hospital admissions. Means we produce the positive outcome by doing the dose range studies and by doing the therapeutic drug monitoring, and this that will lead to reduced hospital admissions. So this is the case report form. In this, we do the put the case number, name of the physician, name of the patient, address of the patient, age, sex, weight, what is the diagnosis of the patient, what is the case history, what is the diagnosis of the patient, what is the case history, what is the past history, what is the family history, what is the drug treatment the patient is getting, what is the dose of that drug and the frequency of that drug, what was the duration of the treatment, why we are doing the therapeutic drug monitoring now, whether to check the toxicity or to check the compliance, time of last dose taken, time of sample collection, what was the last dose taken and what was the time, and what was the time of the sample collection, any concomitant therapy is given or not, and any other biomedical tests. This is again request form of TDM. The patient's initials will be given. Drug level requested. Reason for request means why we are doing the therapeutic drug monitoring. It is for suspected toxicity, compliance, therapeutic confirmation, or absence of therapeutic response. It is when we have to do the dose levels, the time is specified. When was the last dose given, time and date, and whether this drug level is specified at trough or pre-dose level or peak level, and whether the patient is suffering from any cardiac, hepatic, or renal disease, and other drug level and usual subtherapeutic range and interpretation. Other drugs, if the patient is taking, that should also be specified. Now, what is limitation? It is the limited number of drugs that are available to therapeutic drug monitoring, and accuracy should be there of the drug assay, and there can be laboratory variability in the reporting. There can be limited accessibility in the rural areas. Validity of the suggested target ranges. It is not well described for most of the drugs is based on very limited number of data. Now, the validity of suggested target ranges is this. It is not well described for most of the drugs. Now, validity is not well described for the most of the drugs is based on very limited number of data. Inappropriate sample timings can be there, or insufficient patient's history or other data is the limitation. Now, therapeutic drug monitoring in India was introduced in mid 1980s, and it has grown several fold with clinical pharmacology as a separate department. Therapeutic drug monitoring service is of two types. In large teaching hospitals, it is done by the Department of Clinical Pharmacology, and in the private sector, it is done by the Clinical Biochemistry Department. Conclusion. Therapeutic drug monitoring is required for effective patient care management. It leads to optimizing pharmacological therapy. As we optimize the pharmacological therapy, decrease the incidence of drug and drug-related toxicity, and decreased disease exacerbation, decrease side effects, reliable, valuable, and efficient tool of patients' compliance and management of the therapy in patients receiving complex co-medication or suffering from other diseases. As this is the very much valuable tool for managing the patient who are taking co-medication and also who are suffering from large number of other diseases also. Thank you. That's all for therapeutic drug monitoring. I hope you like this video and you understood it as well. And if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. It's Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Stay safe, be blessed, be happy, be healthy, be wealthy. Thank you.